Hello guys, let's discuss about rheumatic fever. In this video, you'll see about the rheumatic fever introduction, etiology, symptoms, pathophysiology, diagnosis and treatment. Rheumatic fever. Rheumatic fever is an autoimmune multi-system inflammatory disease that occurs a few weeks after group A beta hemolytic streptococcal infections occur or enter the body, causing pharyngitis, a sore throat. It also occurs rarely with the streptococcal infections at the other sites such as skin. Rheumatic fever is principally a disease of childhood with a median age of about 10 years, although it also occurs in the adults. Let us see about the etiology. There are two main etios. One is the streptococcal infections and the other is the genetic factors. A sore throat from the bacterial group A beta hemolytic streptococcus, which can pass easily from the person to the person in the same way as that of any other upper respiratory tract infections. These are the two main etios that are causing the rheumatic fever. One is the streptococcal infections and the other one is the genetic factors. Now let us see the symptoms. Fever, joint pain, swelling, most often which is seen in the knees, ankles, elbows or wrists. Joints may feel hot or tender. Pain in one joint that travels to the other joint. Chest pain and fatigue. Small painless bumps beneath or under the skin. Flat or slightly raised painless rash with a ragged edge. These are the main etiological factors that include in the rheumatic fever, and there are some other listed. In the next slide, let us look into the rheumatic heart disease symptoms. They are coughing, fatigue, palpitations, lightheadedness, swelling, chest pain, shortness of breath, weight gain, joint pain, skin changes. Some of the potential risk factors for the rheumatic heart disease include having repeated streptococcal infections, no proper maintenance of hygiene, contracting scarlet fever, and skipping the antibiotics for the strep or the scarlet fever treatment. These are some of the symptoms and the potential risk factors that are included in the rheumatic heart disease. Now let us see about the pathophysiology. Streptococcal infections once entered inflame the heart tissues and cause fever that affects the heart valves, resulting in the leakage and narrowing. As compensatory mechanism changes in the chamber size that leads to the thickness of the chamber wall. And this is about the entire pathophysiology of the rheumatic heart disease, how it is ongoing and how it is occurring when it is entering a patient's body. In the next slide, let us see about the diagnosis of the rheumatic heart disease. It is treated through echocardiogram and ultrasound of the heart, which can assess the heart valves and look for the heart failure. Major diagnostic criteria include carditis, polyarthritis, chorea, erythema marginatum, subcutaneous nodules. Carditis is an inflammation of the heart. Polyarthritis means 5 or more joints in the body have arthritis at the same time. Chorea meaning a neurological disorder that is categorized by spasmodic involuntary movements of the limbs or the facial muscles. Erythema marginatum is a rare skin rash that can appear as a circular and red. Subcutaneous nodules are firm raised lesions that can appear under the skin. Let's discuss about the treatment. The primary goals of the treatment are suppression of inflammation and relief of acute symptoms, eradication of the gas infection, prophylaxis against future infection to prevent the recurring heart diseases. Aspirin controls fever and pain caused by the arthritis and carditis. If the therapeutic benefit hasn't occurred after the fourth day, which is sometimes the case of carditis or arthritis is severe, NSAID shouldn't be abandoned in favor of a corticosteroid, prednisone. If the inflammation isn't suppressed after 2 days, an IV corticosteroid pulse of the methylprednisolone succinate may be given. Antibiotic prophylaxis. Anti-streptococcal prophylaxis should be maintained continuously after the initial episode to ARF to prevent the reoccurrences. This is about the treatment. For more information, you can refer these sites. Thank you. This is about the rheumatic fever.